The sacro-iliac joint is a joint which is commonly responsible for low back pain, particularly pain which is on one side and goes into the buttocks or into the leg as well. And so because of that reason, it can commonly be confused with sciatica. The site of the sacroiliac joint is here. It sits either side of the tailbone. It joins the pelvis with the tailbone. Here's the front view. And you can locate it by putting hands on the hips, and it's just beyond the point of the thumb. This is a problem which is common in pregnant women because you get laxity of the ligaments around the pelvis, but it's also an injury which can occur from repeated bending and twisting, and it can also happen if you mistime a step, for example, stepping over a curb or stepping off a ladder early, and it's the shock going through the leg can disrupt the joint. The type of pain that you would get would be, what would be difficult to do would be loading the leg. For example, going downstairs, that can be difficult to put weight through the affected side. Also, movement after being still for a period of time. For example, standing up after sitting. That's a classic sign. What I'm going to show you now is a couple of techniques which you can do to help this problem. The first one is a joint positioning technique to help the joint get into a better position to enable better movement and obviously more comfortable movement. It's also a stability exercise. The second one is a postural correction technique which is useful for the sitting position to enable the motion of standing from sitting to be easier and to be more comfortable. So thank you for watching. Have a look at these now. The exercise which I'm due to demonstrate now is a positional correction technique for the joint. I'm going to move the leg on the painful side and the opposite arm. It's not a huge movement that I will perform. The leg will remain straight, the arm will remain straight. So I'll demonstrate now. It's the painful side, right, SIJ. So you would do 10 repetitions, have a rest, and do 3 sets in total. This is an alternative position for the technique just demonstrated. Right side is the painful side again. Left arm up, move them both back behind you at the same time. This technique is forward pelvic tilt. The purpose of this is to encourage a better position of the joint, but also to prepare it for the transition from sitting to standing. So what it does is it gets the joint in a good position to go through that motion, and it means that there's less load and strain placed through the joint, making it more comfortable. So this is the action. It's forward tilting of the pelvis. You can see there the arch of the lower back increases as I do that. You do that 10 times, and then finally get into the position and then rise from sitting.